Well, we're going to bring in back NBC4 contributor Nurse Alice Benjamin with more on the president's diagnosis. Nurse Alice, good morning.
Hi, good morning.
Now, the president's doctor has said in a letter that in addition to the Regeneron treatment, Mr. Trump was also taking zinc, vitamin D, melatonin, a daily aspirin, a heartburn drug. What exactly is Regeneron, and why is he taking these other things for COVID? How can they help him?
So this Regeneron treatment is something that is new for many of us because actually it's still in clinical trials and is not FDA approved for emergency use. And what it is monoclonal antibody treatments. So what that is for just in very simple terms, they're artificial antibodies that are given intravenously and are meant to help kind of kickstart or boost the immune system with helping to develop its own antibodies. So we really don't know much about this drug yet, other than the president requested to use it. Now, the other drugs the president is taking, the zinc, the vitamin D, melatonin, aspirin, and the heartburn drug, those are all medications that in smaller studies have been shown to help decrease the inflammatory process, have been shown to help somewhat in offsetting COVID-19 symptoms, but there's no true hard data. So we like to consider those things complementary alternative treatments. So it sounds like he's doing anything and everything he can to fight this disease.
And we've learned that a number of people who attended an event at the Rose Garden a week ago today have also tested positive. I want to talk about the incubation period, which I guess typically lasts 2 to 14 days. When do people usually start to present their symptoms, and what does that mean for when they were exposed?
Absolutely. So that event seems to be a super spreader event. I'm really disappointed that that was allowed to occur, but people typically develop symptoms anywhere from 2 to 14 days. That's the time frame. But most people will develop symptoms anywhere between 5 to 7 days. So I know people who've been around the president are getting tested. Like Vice President Pence, his test was negative, but he's still not out of the clear. He still needs to quarantine himself, as well as, Joe Biden, because they were at the debates. Anyone who's been in contact with the president needs to quarantine for at least 14 days to make sure that they don't develop symptoms and to prevent the spread. Even if they're asymptomatic, because we know that you can still be contagious 2 days prior to developing symptoms.
And we're told the president is in good spirits, but there is concern over how the president will be feeling over the next 7 to 10 days. Can you talk to us about how critical this time will be for the president to improve?
Right. So the president just began to present with symptoms. So his body is just starting to build a viral load of coronavirus. And as his viral load rises, that's when he'll probably start to develop worsening symptoms. Hopefully not, but given his pre-existing conditions, his age, his lifestyle, it's something that we do as health professionals anticipate, which is why he's probably in the hospital, just for that close surveillance and access to that emergency treatment. But we're going to be looking for any type of worsening in his breathing, shortness of breath, signs that he might be developing a secondary infection such as pneumonia. We'll be looking for neurological changes, dizziness, fatigue, sometimes seizures, and also the potential for clotting is there. We have studies that show that people who have COVID-19 have inflammatory process throughout their body, makes them prone to clots. So we've seen people develop deep vein thrombosis, pulmonary embolisms, and even stroke. So these are all things that we're going to want to watch. Again, also watching his lungs primarily, looking at his oxygen status, and just making sure that if something happens, if he has a symptom, we're going to try to manage and treat it as soon as possible.
Nurse Alice, you touched on this just a moment ago. Again, we just learned a few minutes ago that Vice President Mike Pence has tested negative for a second time. So in all likelihood, does that mean that he doesn't have it?
Not yet. Still too early. So we have to look at when Vice President Pence's last contact was with the president, because that will begin his 14-day window. And this is important for viewers to know. If you come in contact with someone who's tested positive for COVID-19, you want to know when was that last point of contact, and that starts your 14-day window of quarantining. So you should be staying away from people to prevent the spread, but you have to wait the full 14 days, guys. So even with Joe Biden, I know he's been out doing a couple of things. He's been in contact with the president, so he himself should be quarantining as well. This is what the CDC recommends, so it should go for everyday citizens as well as politicians who are running for office.
Nurse Alice, we've had so many questions for you. Thank you again for joining us once again this morning. We appreciate it. All right, 7:50 right now. We want to switch